Let me call. Or I will just reply all. But I don't.
So welcome, colleagues. Can you hear me?
Yes, we can hear you. If we can just give the colleagues 2 or 3 minutes to connect.
Okay. Jaka, can we start now?
Yes, I think we can start now.
So, dear colleagues, I will start by giving housekeeping. Dear participants, you are invited to introduce yourself by writing in the chat your name, title, and affiliation. This webinar is run in English. There is no translation or interpretation. Questions and answers will have 2 options. The first option is to raise your hand and wait until the moderator gives you the floor when time permits. And the second option is to ask the question using the Q&A function, and then you will get an answer by the facilitators in the Q&A function. For any other issue, you can send an email to kariope@who.int. Now, I am going to ask the panelists to introduce themselves, starting with Dr. Irina Papieva. Introduce yourself.
Thank you very much, Pierre, and good afternoon, colleagues. I hope you hear me well. So my name is Irina Papieva, and I work as the technical officer in the patient safety flagship team in the Integrated Health Services Department in WHO headquarters, and currently leading the work of patient safety. Thank you very much. Over to you, Pierre.
Thank you. Dr. Nikhil Gupta, go ahead.
Good afternoon, colleagues. My name is Nikhil Gupta, and I am a technical officer with the patient safety team here. Thank you so much for inviting us. Over.
Yes. Dr. Avotri.
Thank you very much, colleagues, for participating in this webinar. Gertrude Sika Avotri is the name. I'm with the WHO AFRO regional office. I'm a technical officer for quality in health service delivery. Thank you.
I'm Dr. Carrillo Pierre Claver. I'm based in Brazzaville, regional office for the WHO African region. I'm one of the organizers, and I will be also standing for our team leader who has not been able to join this webinar. So I hope, Jaka, you can display the agenda. We will have quickly 3 sessions. The first session will be moderated by Dr. Avortri in a few minutes. That will give me give an overview of the global patient safety landscape and global patient safety action plan 2021-2030. And then we will have a presentation from AFRO that will be given by myself. And the second session will be focused on Global Patient Safety Report 2024 with highlights for the African region, and will be followed by approaches on implementation. The third session will be about country presentations. 3 countries will present this afternoon, namely Ethiopia, South Africa, and Liberia. And then we will conclude the webinar. For the interest of time, I will give some remarks on behalf of my, yes, thank you, Jack, for displaying the agenda. Now, on behalf of our cluster called Assistant Regional Director Cluster, our unit, which is called Service Delivery Systems, and PHC is the main organizer of this webinar. So, dear participants, dear panelists, ladies and gentlemen, all protocols observed, I would like to say that patient safety is defined as the absence of preventable harm to a patient and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. Within the broader health system context, it is a framework of organized activities that creates cultures, processes, procedures, behaviors, technologies, and environments in healthcare that consistently and sustainably lower risks, reduce the occurrence of avoidable harm, make the error less likely, and reduce the impact of harm when it does occur. In recent times, patient harm from unsafe care has assumed a significant and growing global public health challenge, as it constitutes one of the leading causes of death and disability worldwide. Most of these harms are preventable. The African region has recognized patient safety as a priority and an important element of a quality healthcare delivery systems for decades. As early as 2008, the World Regional Committee for Africa adopted the resolution AFRO 58/8 to urge countries to pay the greatest attention to patient safety issues. To facilitate implementation, developing a national patient safety policy and strategic plan was designed to support the country's efforts to improve healthcare safety. Other important efforts in the past included the WHO African Patient Safety Partnerships established in 2009, the ISQA high-level group, and the organization of a patient safety forum in Cape Town in 2019. The conference outcome was the adoption of the African Charter on Patient Safety. In 2021, AFRO organized its first webinar, so this one is the second, to raise awareness of patient safety in healthcare and disseminate existing tools to member states. I wish to remind us that World Patient Safety Day, observed annually on September 17th, was celebrated this year on the theme Improving Diagnosis for Patient Safety with the slogan Get It Right, Make It Safe, highlighting the critical importance of correct and timely diagnosis in ensuring patient safety and improving health outcomes. Celebration of the day helps to galvanize global and national action for safer systems for health service delivery. Looking at the webinar agenda, I'm confident that you will have the opportunity to discuss not only the what, but also the how to achieve these objectives. WHO is committed and will continue to support all member states and countries to scale up programs to make health services safer at all levels. I wish you fruitful deliberations. Thank you. Now I will hand over to my colleague, Dr. AFRO, that will chair the first session. The floor is for you. Thank you.
Thank you very much, Pierre.
Yeah.
Okay, in order to save time, we will just go ahead with the program. The first presentation on overview of global patient safety landscape and the global patient safety action plan will be delivered by Dr. Irina. And then it will be followed by the overview from the African region, and then we'll have a Q&A session. So over to you, Dr. Irina, you can proceed. Thank you.
Thank you very much, Dr. Gertrude and Dr. Pierre, for introduction. So let me just share my screen. Can you confirm that you can see my screen?
Yes.
Perfect.
Go on slide mode, please.
maybe.
Yeah,
Slide
perfect.
mode. Yes.
Thank
Thanks
you.
very much.
Thank you very much. So good afternoon, dear colleagues. Again, it's a great pleasure to have this opportunity to share with you what is happening in the area of patient safety at the global level, and to share also with you the key framework for action that guides us, our stakeholders and countries in implementing patient safety activities in policy and practice. I think all of you know very well that patient safety is the foundation for any healthcare system, and it is a timeless reminder to all of us that patients should be put in the center of medical practice, and patient safety should be prioritized in any decision we make and in any action we take. While healthcare aims to heal patients and ensure that we have good health outcomes, the unfortunate reality is that we are harming our patients in healthcare. And based on the recent evidence, we know that 1 in 10 patients is harmed while receiving healthcare, and around 3 million deaths occur every year due to unsafe care. Apart from these consequences, there is a huge economic burden of unsafe care. More than $1 trillion is wasted because of unsafe care. There are broader implications, indirect implications of unsafe care, such as, for example, the altered health-seeking behavior among populations that indirectly will impact the access to healthcare and the coverage. There is also a huge issue of morale and well-being of healthcare workers that also will indirectly affect patient safety. Not to say that there is a huge reputational damage to healthcare systems, because if the care is unsafe, there is no trust of the populations, and again, it's like a vicious cycle. It will definitely affect the utilization of healthcare services. And finally, we have issues with public health opinion about the value of investing resources into healthcare. So that's an unfortunate reality. And perhaps the only figure that we can see in this slide, the only positive figure in this slide is that 50% of harm in healthcare is preventable, which means we can do a lot to make this percent to grow. So why patient safety is important? As I mentioned, it's the foundation. It's a prerequisite for quality of care, because if we can't ensure that our patients are safe, other dimensions, other elements of quality, such as effective treatments or efficiency, will lose their value. Why does quality of care matters? According to the recent evidence, we can say that more than 5 million deaths per year are attributed to poor quality of care in low and middle income countries. And what is shocking, that this figure is much higher than the figure that results from the non-utilization of healthcare services. Also, we know that high-quality health systems can prevent each year around 2.5 million deaths from cardiovascular diseases, around 1 million deaths from TB, 1 million newborn deaths, and it can also have impact on half of all maternal deaths. So quality of care is at the core of the universal health coverage. There is no universal health coverage without quality of care, and universal health coverage, as you know, is just one of the objectives of the Sustainable Development Goals. So definitely we can't achieve UHC, and we can't progress meeting the Sustainable Development Goals if we don't put enough emphasis on improving quality of care. We can have impact only if the coverage is multiplied by equity and multiplied by quality. So today's presentation will focus on the case of patient safety. And as many of you know, the global movement around patient safety resulted in the World Health Assembly resolution that was adopted back in 2019 on global action on patient safety. The same resolution recognized patient safety as a global health priority. The same resolution also established an annual World Patient Safety Day to be commemorated annually on 17 September, as was mentioned by my colleague Pierre. And the same resolution also requested the Director General of WHO to formulate the Global Patient Safety Action Plan to lead the patient safety improvements in policy and practice around the globe. We have worked very closely with our member states and with partners following the adoption of the resolution, and the Global Patient Safety Action Plan was adopted by the World Health Assembly in 2021. Some of you may say that we have quite an ambitious vision in the Global Patient Safety Action Plan, but we do believe that we really can work towards achieving the maximum possible reduction in avoidable harm due to unsafe care globally. So before I proceed with the presentation, I would like to pose a question to all of you, please. We want really to know how familiar you are with the Global Patient Safety Action Plan and its 7 strategic objectives. And to answer to this question, you have a QR code that is displayed here. So you can easily scan the QR code and answer to the question. We have provided 4 options for you that also you can see on the screen. And we will give you a couple of minutes to respond, and then we will see all together how much you are familiar with the Global Patient Safety Action Plan and the strategic objectives of it. It's just excellent. I see excellent results coming up. Okay, now it's changing. Mhm. Okay, yeah, results are changing. Yeah, what I have seen in the beginning was, yeah, so good. Okay. 1 more minute, I think we can go. Mhm. Okay, yeah, okay. Mhm. Okay, yeah, so let's see together the results. So I have seen around 13% of the countries that sat of the participants, sorry, that are fully aware of the Global Patient Safety Action Plan. And thanks a lot for your responses. It's very, very encouraging to us. So fully aware and actively implementing them, around 18% of participants are there. Somewhat aware, we have 30%, and we have 41% of participants who are not aware of the Global Patient Safety Action Plan. So we're very happy to have this opportunity to share with you the plan, the strategic objectives, and the way to go. I see again the results are changing somehow, but not much, not much. So 37% of participants are not aware, as I see. Thank you. Thank you very much for your responses, for your active participation. I think we can proceed now. So, it's not changing. Okay. So here it is. Here we see the Global Patient Safety Action Plan, 7 strategic objectives. And we will deep dive into all of them. But just to summarize here that the strategic objectives range from ensuring that we have policies to eliminate avoidable harm, to building high reliability systems and ensuring safety of all clinical processes in healthcare. The strategic objectives also tackle the issue of patient and family engagement, building competencies of health workforce, ensuring that we have information systems to collect information and use that for proactive risk management. And the plan also tackles the issue of building strategic partnerships, ensuring synergies and solidarity among key stakeholders. Each strategic objective is further elucidated into the 5 strategies, giving us a wonderful framework for action, 7x5 matrix with the 35 very concrete strategies to ensure patient safety. And within the strategies, you can find the actions that are directed at different stakeholders and stakeholder groups, including governments, healthcare facilities and services, the partners that are working also in the area of patient safety, and And we, WHO Secretariat, also have a responsibility to implement the Global Patient Safety Action Plan and support our countries and our partners. So now we will try to go very quickly to the strategic objectives. So the strategic objective 1 deals with having policies to eliminate avoidable harm in healthcare, and the strategies that are covered there include development of the policies, ensuring that we have resources to implement those strategies. It talks also about ensuring that we have the respective legislation and regulatory framework to support implementation of the strategies. And the strategic objectives talks about establishment of the safety standards and having the regulatory framework to ensure their implementation. And the same strategic objective also covers the implementation of the global campaigns and global patient safety challenges. The very specific things to mention here perhaps is that when we work with countries, we try to provide bespoke support to the countries in the development of their policies and strategies to improve patient safety. We have different mechanisms to do so. There are structured mechanisms such as, for example, Global Patient Safety Collaborative, and there are 2 countries in Africa that are benefiting from this support, including Kenya and Ethiopia, but we're also addressing ad hoc requests that are coming from the countries. The same bespoke support is provided in the area of legislation, regulation, safety standards, and when it comes to the global initiatives, as was mentioned already, the key initiative that we use as a platform to advocate for patient safety is the World Patient Safety Day that we celebrate every year on 17 September, and we choose different themes to highlight the urgent patient safety area of work. Another mechanism to advocate for patient safety improvement is through the Global Patient Safety Challenges, and so far WHO has launched 3 of them. One of them was related to the hand hygiene, and you know that the campaign continues until now. The second challenge was about ensuring safe surgery, and the third one that we are in the process of implementing for the moment was launched in 2017, is related to ensuring medication safety. Building high reliability systems is extremely important for patient safety because harm can happen at any care point in every setting and in every context. So it's really important that we establish good governance practices for healthcare systems, that we instill a no blame, transparent and open culture, so we can report incidents and learn from them, and try to design the risk management approaches based on our learnings. Application of human factors in order to ensure patient safety is also extremely important element in these strategic objectives, and ensuring patient safety in emergencies and settings of extreme adversity is also another important element in this area. The resources that we have here are related to the incident reporting and learning systems and minimum information model for patient safety. We have also produced the rapid review on the implications of COVID-19 pandemic for patient safety, and we are currently working on the operational guide on how to ensure patient safety in pandemics and emergencies. Safety of clinical processes. When it comes to these strategic objectives, what is important for us to understand what are the major sources of harm in healthcare, and I would highlight just a couple of them. The medication errors are the leading source of patient harm in healthcare, with 5% of patients affected globally. 16% of preventable harm across the health system is due to diagnostic errors, and it was one of the reasons of choosing the theme of diagnostic safety as a theme for the World Patient Safety Day 2024. We have huge burden of harm associated with healthcare-associated infections that sometimes results also in sepsis. The VTE is one of the most common and preventable cause of patient harm, and we know that the incidence of VTE is around 5 to 12 people per 10,000. Other sources of harm include patient falls, pressure ulcers, patient misidentification, unsafe transfusion, and injection practices. So the strategies under these strategic objectives are aimed to ensure the safety of clinical processes, focusing on the major sources of harm in healthcare. Here we put a lot of focus on infection prevention and control, and the linkages with antimicrobial resistance, and on the global patient safety challenge, medication without harm. To highlight here the medication without harm challenge, that was chosen again due to the fact that the most harm is happening because of medication errors, and WHO has produced a number of technical guidance and resources to support implementation of the challenge. So we have a systematic review that will help to prove the case of high burden of medication-related harm in healthcare. The challenge that was launched in 2017 with a very clear strategic framework to implement, policy brief to build the case, and a number of resources, including the global campaign No Check Ask, the WHO Patient Safety Curriculum Guide, the module on medication safety, a number of tools to engage patients and families in making medication use process more safe. When it comes to infection prevention and control, there is a huge number of technical tools and resources that are also produced by WHO. We have a team, we are working very closely in headquarters that ensures implementation of infection prevention and control practices at the point of care, as well as addressing IPC in policy level. I think the highlight of the Global Patient Safety Action Plan is the focus on engaging patients and families in ensuring patient safety, and the strategies in these strategic objectives covers co-development with patients and patient advocates, learning from their experiences, building their capacities, and also providing information and education to patients and patient groups. And a couple of highlights to share with you is the Patient Safety Rights Charter that was launched last year within the framework of the World Patient Safety Day 2023, that was dedicated to patient and family engagement, and a wonderful patient engagement tool that is called 5 Moments for Medication Safety that was co-developed with our patients. We are about to produce WHO Patient Safety Storytelling Toolkit that can support building capacities of patients and their representatives in speaking up and in telling their stories of harm and beyond. And we try to collaborate with patient and family organizations so we can implement the strategic objective of the Global Patient Safety Action Plan. One of the strategic objectives is aimed at building competencies of health workers, and here we try try to tackle patient safety in professional education and training, also establishment of the centers of excellence to support patient safety education and training initiatives. We're also promoting incorporating of patient safety in the performance of health workers and linking patient safety with appraisal system for health workers. Another important element here is ensuring safety of health workers, because there is no patient safety without health workforce safety. A couple of highlights to mention here is a WHO Patient Safety Curriculum Guide, multi-professional edition that is currently going the revision into the interprofessional edition, focusing on the competency-based education, as well as WHO course called Patient Safety Essentials that will be free of charge, fully online course that will be available for the health workforce around the globe. The strategic objective number 6 deals with information systems, research and risk management for patient safety. We have a publication that helps countries to identify priorities for research in patient safety, which is extremely important because, yes, we have global evidence, but in many cases, we really need the contextual research initiatives to understand what is going on in a very specific settings. Patient safety incident reporting and learning system is perhaps a bread and butter of the patient safety, because again, through learning from incidents or near misses will really help us to put emphasis on prevention and proactive risk management. And the final strategic objectives is related to building strategic partnerships and ensuring that we synergize and align all our activities with other programs and across different stakeholders groups. And a couple of highlights here include the Global Patient Safety Network, a platform that brings together countries, professional organizations, individual experts, to share their experience, to share knowledge around patient safety. Another platform, global knowledge sharing platform, that is a one-stop shop for patient safety tools and resources. And the strategic partnerships, to highlight here the global ministerial summits that happen annually that bring together ministers of health as well as technical experts to discuss burning issues around patient safety, and different collaborative models that we are trying to build to support country action around patient safety. When there is a framework for action, there should be a framework to monitor progress. And the Global Patient Safety Action Plan incorporates a number of core indicators to monitor progress. And based on the member state survey that we have initiated 2 years back, the achievement at the global level of the core indicators looks like you see on the screen, which tells us that there is a long way to go. We will have an opportunity to deep dive into the results of the member state survey later on during the webinar, but the highlight here is definitely that we have to try harder. The Global Patient Safety Report that was released in May 2024 also will be discussed later on, so I will not put much emphasis on this. So the last slide is really how we approach implementation of the Global Patient Safety Action Plan at the country level. And there are a couple of critical things to have in mind while you will be ready to implement Global Patient Safety Action Plan or in the process of implementing. Patient safety is extremely important element. It's a foundational element for healthcare systems, but unless you put the patient safety within broader health system strengthening agenda and understand how that will contribute to the broader UHC agenda of the country, I don't think that we can succeed much. It is extremely important that the activities that you are planning around patient safety are very much aligned with the existing policies and strategies and implementation plans that intersect with other disciplines. It is also very much important to align whatever you plan with the governance mechanisms, organizational structures, management, and local expertise, so you are able to implement what you plan. And it is also important to understand that, yes, we have a lot of things to do. Everything is important, but prioritization exercise is also extremely important, so you can progress gradually in improving patient safety. What is not monitored and measured can be improved. So whatever you do, you have to think about having very robust accountability and measurement frameworks with a balanced choice of the indicators that will cover different elements like input, process, and outcomes. It is important to ensure that there is a multi-sectoral collaboration, because many of the strategies will require engagement of other ministries and other sectors, for example, ministries of education. It is extremely important not to forget include private sectors in the implementation of the plan and have a diverse stakeholders in your coming together to implement the plan. What is also important that you find a very good balance between interventions at policy, organizational, and point of care levels, and that you have a very robust collaboration and coordination mechanisms established, be that institutional or functional. I think that's all from my side, and I thank you for your attention. We'll be more than happy to answer any questions you may have later on. Thank you very much.
Yeah.
To you, Gertrude.
Irina, for highlighting what is happening at the global level, this action plan, and then the key strategic documents that have been produced to help operationalization. Thank you very much. We'll take questions later on after the next presentation on what is happening at the regional level. Dr. Carrillo, over to you. You are muted, Dr. Carrillo. You are muted. We cannot hear you. You are still muted, Dr. Carrillo.
Can you hear me now?
Yes, we can hear you. Please go ahead.
Yes, thank you. I'm sorry.
So I will give you an overview of the patient safety landscape in the African region. Can you hear me?
Can you put it in a slide view? You are in a presenter view.
Yeah. Is okay now?
No.
Not yet.
Maybe you can stop sharing and then share the window where you see the PowerPoint in slide mode.
Okay now?
Yes.
Thank you.
So patient safety, like it was highlighted, is a global public health issue that affects all types of healthcare systems, whether developed or developing. Up to 70% of healthcare errors are estimated to be preventable, with an estimated 10% of all inpatient visits resulting in some form of unintended harm. And this is of greater probability that adverse events are more frequent in developing countries. For the following reasons, we have many gaps in health services coverage and loss of information. There is a high number of inpatient visits within the African health facilities that highlights the potential magnitude of unsafe practice, and health actors typically operate as separate entities. So the key milestones in AFRO quickly in 2000, it started globally in 2000 with the US publishing the report To Err is Human. And following those years, in 2008, after the global resolution, AFRO adopted a resolution on patient safety in Africa called Issues and Solutions. In 2010, we started mobilizing civil society and we organized the first Patient Safety Association in Kampala in December 2010. And the following years, we put an emphasis on safe surgery. We also, in 2009, established a regional patient safety network to raise awareness by running workshops. And between 2010 and 2015, we had an international partnership with North to South partnership and South to South partnership that went very well. So we also in 2019 launched the Global Patient Safety Global Plan, and at the African level, we had the African Patient Safety Initiative in Cape Town, like I was saying in the opening remarks. We also organized the first webinar, like I said earlier, also in 2021. This is the second one we organized. The one in 2021 was just after the COVID-19 pandemic. And we feel like having a series from now would be very beneficial, particularly supporting countries to implement the Global Patient Safety Action Plan 2021-2030. We also highlight that since 2019, each September 17th, we celebrate the Global Patient Safety Day. And we continue to support countries technically to develop policies, strategies, plans, and roadmaps to improve patient safety in health settings. Current initiatives can be highlighted in several countries on medication safety, patient engagement for patient safety development skills during pre-service education, and through inclusion of patient safety in professional curricula. We are also supporting countries to develop reporting and learning from adverse events, and we continue to support countries to implement as much as possible the surgical safety through the WHO Safe Surgery checklist. There was also a lot of emphasis in IPC where most of the countries in the African region are implementing WHO guidelines and developing activities to implement improvement activities on IPC, as IPC is really very central to patient safety, like my colleague was highlighting. Today, we'll have 3 countries sharing the experience: Ethiopia, Liberia, and South Africa. And tomorrow, we'll have another 3 French-speaking countries: Cote d'Ivoire, Senegal, and Burkina Faso. We also need here to highlight 2 collaboratives in Africa, Ethiopia and Kenya. These countries are implementing activity to secure and scale up global action on patient safety to reduce the risk of avoidable harm and improve the safety of health systems. Here I want to highlight the many issues and challenges that we encounter in Africa, particularly we find limited leadership commitment with weak governance and coordination structures, weak health system, including inappropriate infrastructure, low use of technologies, under-equipped health facilities, and shortage or counterfeit medicines, limited funding and inadequate human resources, ineffective information and data management systems. We also have a culture of denial, whereas we should implement a culture, a patient safety culture, saying that first, do no harm. We also have, like I was saying, weak communication systems where the blame culture prevails, still prevails, I would say. Leadership with weak accountability in healthcare systems at all levels, error identification due to weak or inexistent adverse reporting and learning systems, and inadequate IPC and control measures. So what would be the way forward? We want to reiterate that patient safety is an attribute of quality of care, particularly crucial when health systems are weak. Always embed patient safety activities in the national effort to improve quality healthcare services for UHC is what we need in the African region. And IPC needs to be emphasized as a strong contributor to safety of care and thus patient safety. We need also to support countries to accelerate implementation of the Global Patient Safety Action Plan. And we intend to have regular deep dive sessions with countries starting from next year. And we hope that will reduce the burden of unhealth care through awareness raising, policy and strategic plan development, networking hospitals, hospital-to-hospital partnerships, strengthening civil societies, putting in place systems to promote learning, documenting and sharing lessons and best practices, and strengthening regional monitoring and evaluation mechanisms. So I think I will stop here and wait for questions. Then we can go and answer them. Thank you. I hope we can keep on time. Over to you, moderator.
Yes, thank you very much, Dr. Carrillo. I think we've made good progress. We still have 5 minutes for questions. If you can take your presentation off. Okay, so we have a function for you to raise your hand. If you raise your hand, you'll be given the opportunity to ask your question. And you can also put your question in the chat, and then we'll try as much as possible to respond. So we have 5 minutes. The floor is open for questions and answers. I'm not sure whether I can see the hands whether they are raised. So if I can get some assistance.
Let us help you.
I don't see any hand up as of now. There is a question in the chat from Regina Kamoga.
Okay, I see that one. The question is which civil society organization or patient organization or patient safety organization are you working with? I think Dr. Carrillo can respond to this question.
Thank you for this question. We normally have in each country civil society organization, meaning patient organization or consumer organization. That country offices in our member states work with. I don't have the whole list, but I know that in Uganda, there are some of those organizations that are well known. Probably activities could have slowed down for different reasons, but we are intending to get back in touch with all those organizations in each country to revitalize our collaboration and support those organizations to implement their activities. Over to you.
Thank you very much. Dr. Irina, do you want to add to this?
Yes. Thank you. Thank you very much.
We've had some work with AFRO, International Organization of Patient Associations. Yes, we've had engagements with them, but Dr. Irina, you can also add to or respond to this question. Yeah, thank you.
Thank you. Thank you very much, Dr. Gertrude. As you rightly said, there are many collaborations that are happening at the global level through different mechanisms. And one of the mechanisms is engagement of WHO, formal engagement of WHO with non-state actors. And one of them is the International Alliance of Patient Organizations that bring different patient organizations from all around the world under one umbrella, and that allows us actually to have a very clear communication channels to those organizations. Another organization we work very closely with is the World Patient Alliance. We don't have the formal mechanism of engagement, but we have very proactive and dedicated patients and patient representatives who contribute to whatever we do here at the global level, including development of the global policies, development of the tools and resources, and as well as building capacities of potential patient champions in other countries. Thank you, over.
Okay, thank you very much. I think we will move on to the next session. So at this point, I will hand over to Dr. Carrillo to take over the moderation of the session, because the next presentation will be done by me. Thank you. Over.
Thank you, Dr. Avortri, for handing back the floor to me. So now it's my pleasure to introduce the next session. Thank you very much for keeping time. It's 2 p.m., which is very good. So the next presentation will be done by Dr. Avortri, my colleague, who will present an overview of the Global Patient Safety Survey, key findings from the African region. You have the floor. I hope you can keep time.
Yes, I'll do my best. Please, can you confirm if you can see my slides?
Yes, we are seeing your slides.
Okay. Thank you very much, colleagues. You've heard a lot already this afternoon about the Global Patient Safety Action Plan. The survey was done, and then I'll just present quickly the findings from AFRO region. I will provide a brief background, but I will not spend a lot of time on it because we've heard already the history of the Global Patient Safety Action Plan, how it came into being. And you've also already been taken through the strategic objectives and then there's strategies for implementing each of them. So the global survey was done in 2021, 2022. We went through a number of phases of drafting the tool and then pre-testing it, sending it to member states and facilitating the process for them to complete the survey. And then the results were out. So for today, I'm going to present just the key findings for the 21 African countries that participated in the survey. So of the 21 countries, we tried to analyze them by income level. We had 21% from low-income countries. We had 6% from upper middle income, and then 15% from lower middle income countries, just out of the 21 that participated. So we tried to compare the overall performance of these 21 countries against the global scores in line with the strategic objectives that Dr. Irina actually discussed with us this afternoon. You realize that our good performance is mainly with strategic objective 1, where it relates to policies to eliminate avoidable harm in healthcare. We are also doing fairly well at trying to get a high reliable systems in place, but there are other areas that we need to really improve on, which you can see is the information research and risk management. I will delve deeper into some of these. With the Global Action Plan, we have some 10 core indicators. And this slide presents our regional performance against the global status. It's a bit disheartening. However, you find that globally, the issue is not pleasing. However, especially when it comes to the number 9 core indicator, whether we publish annual reports on patient safety. Of the 21 countries, the response was 0%. And also having established national patient safety networks. This one, it refers to specific countries having national patient safety networks. We did not do so well on these core indicators. I'll present briefly our performance on each of the strategic objectives and also on the strategies. The key there that I want you to have a look at is the colors. Anything close to red means is basic performance. Anything close to yellow is we are making some effort progressing. And then anything green is advanced performance. So in the African region, 20% of countries have developed National Patient Safety Action Plan or its equivalent. Most of our countries, 60%, have launched the World Patient Safety Day, and they do celebrate that. However, you realize that when it comes to the strategies, we want to highlight making available resources for implementation. We did not do very well in this area in the African region. Additionally, I want to highlight some of the details regarding the strategic objectives. Just to mention that 50% see patient safety as a national priority, and 15% of the countries that participated have established a national patient safety program. But most of our countries do not have a program on patient safety. Also, 50% of the participating countries are implementing at least one of the global patient safety challenges that Dr. Irina talked about. This is under the strategic objective 1. For strategic objective 2, we are not doing very, very well. This is the area of high reliability systems for patient safety. You'll find that we have most of the rates in this area compared to other regions, other WHO regions. So transparency and openness, we are not doing so well. Leadership capacity for clinical managerial functions, we are not doing that well. The same applies to patient safety in emergencies in settings of extreme diversity. So we have a number of areas to improve on. These are additional findings still on strategic objective 2. Just to highlight that there are gaps, huge areas for improvement that we need to consider going forward. For example, only 5% of the countries reported having specific surveys and assessments on organizational safety culture. It's important for us to know the culture of our organizations, and that will help us to put in mechanisms for improvement. So these slides will be shared with you so you can see the details, the nitty-gritties of the performance on each of the strategic objectives. For strategic objective 3, which relates to safety of clinical processes, we are not that bad compared with other regions. However, we need to really improve on safety of risk-prone clinical procedures, the mechanisms that we put in place to address them. We are comparable with what is happening in other regions of the world. This slide also provides additional findings on strategic objective 3, based on the 21 countries that participated in this study. I will just mention maybe just one of them. 23% of the countries have mechanisms for measuring medication-related harm, whilst 19 have set national targets for reduction of medication-related harm. We still have room, a lot of room for improvement. I wanted to highlight this as well because we are in the era of implementing medication safety or challenge or improving the mechanisms that we've put in place regarding medication safety. So Africa, I don't know whether you can see my cursor. When it comes to addressing issues of high-risk situations, you see that we are just above 40% in doing that. Also implementing issues to address polypharmacy, we are just above 50%. And where we are not doing very well is issues related to transition of care. So these are some of the areas that you need to highlight as you go back in improving patient safety in your regions. Strategic objective 4. This area, patient and family engagement, there's a lot of room for improvement in all regions, but most especially in the African region. You see that the colors are more red for Africa than the others. These are additional findings on family and patient engagement. And it will help you, once you look at the slides again, it will help you to see how you can improve on some of these areas. Still on strategic objective 4, I wanted to highlight the availability of guidance on obtaining informed consent from patients and families. And this is important because it's not only that we need to get the consent of our clients before we do things. We need to have these systems in place so that we don't harm people, or we get their consent before we do procedures or other things on them. And I'm happy to note that there are some countries that have started implementing mechanisms to improve this, and we are helping them to develop the guidance and the different kinds of forms that they can use to improve performance on this area. Informed consent is really important for us to seek the consent of our clients before we carry out procedures. Healthcare worker education, skills, and safety. Every strategy under this is red for AFRO. This is an area that we cannot overemphasize moving forward in addressing patient safety in our countries. When it came to occupational health and safety, addressing the safety of our healthcare workers, in the African region, we are lagging behind. Even with all the efforts that we put in during COVID, we still need a lot to do in order to improve mechanisms for assuring the safety of our healthcare workers. The sixth strategic objective, performance is no better. You can see that strategies, patient safety incident reporting and learning is in red. Patient safety information system is in red. Patient safety surveillance system is in red. Patient safety research programs is not doing so well. And somebody has already highlighted the issues of using digital technology for patient safety. We need to improve on this area of work. I'm hoping that the next survey that we're going to start very soon will see a lot of improvements in these areas that we are lagging behind. This is also some of the indicators on patient safety incident reporting compared to other regions globally. The last strategic objective is on the partnerships and solidarity. We still have a lot of room for improvement. It's not all gloomy. It seems so, but I'm sure that colleagues, we can do better moving forward with all the help that we are getting at the global level and from our member states to improve on these indicators going forward. This is also about partnership, just providing some details on some of the organizations that we are working with to help us to improve on our partnerships and synergies. So major improvement areas that we want to propose for consideration is leadership. You see from strategic objective 1 performance that we really need to do a lot in this area. Leadership commitment is key, including strong integrated national approach to implementation. A lot has been said about quality of care, patient safety, IPC. We need to assess our national context and determine whether we want to have individual programs or have some kind of integrated approach or national approach to implementing these related programs for patient safety and quality of care. Also, other areas for considerations that we need to look at: coordinated investment to support holistic implementation for sustainability, continuous awareness creation. This has been said by Dr. Carrillo. We need to continue that so that people get to know what is expected of them and then what to do. We also need to continue systems to support healthcare workers, develop our occupational health and safety mechanisms and legal protection for our healthcare workers so that they can feel free to report incidents and then we can address them. Information, monitoring, and evaluation. We need to know our status. We need to know whether we are making progress. And so therefore we have to put systems in place to continuously assess and evaluate the incidents and then the mechanisms that we are putting in place. I think this is my last slide. Thank you very much, and over.
Thank you, Gertrude, for the good presentation and keeping in time. So let me give the floor to Dr. Gupta, who will take us through the approaches for the implementation of the Global Patient Safety Action Plan. Please take the floor, Nikhil. You are muted. You are.
Thank you so much, Dr. Pierre. And just please confirm, can you see my slides? Can you hear me and see my slides?
Yes, we can see. Yeah.
So thank you so much again for the opportunity to present. And this is the cascade kind of how this workshop is designed. So we discussed about the global overview and the global patient safety action plan, and then we discussed about the regional opportunities and challenges, and very wonderful presentation by Dr. Gertrude about what is the regional status. I would also like to thank you, all the member states, colleagues from the ministries of health, those from 21 countries, those responded to the survey, because it's not only the status of your country, we get a bigger global picture because of your investment of time and resources in responding to this survey. So what you are looking at, what Dr. Gertrude was presenting, it cannot be done or made possible without your contribution. So we look forward further because this is not only one cycle of survey, we'll be having subsequent cycles of survey, and it will be good to also see what Dr. Gertrude also said, how we improve, and that way, yeah, our performance is humble. I would say globally also and AFRO, but that also I would say is a positive sign. There is a huge scope of improvement there. So whatever now we will do from here will improve our graphs. Next time there will be less reds, there will be more greens and yellows, and this will give us all a very much a professional and achievement. So yeah, this is all collective efforts, and we will look forward that how the performance improves over the time, because the global patient safety action plan is till 2030, and let's target maybe by 2030 we have everything green. With that, and how we do that, so certainly what Dr. Irina earlier presented about the Global Patient Safety Action Plan, that is our frame of implementation, those 7 strategic objectives, and on which we are measuring the performance. So that is our guiding resource, that is our framework, that is how we are going to implement. What I'm going to present is more a step-by-step approach. So we have to implement these 7 strategic objectives from where we start, because there are plenty of recommended actions for governments, for healthcare facilities, even for WHO. But if a country wants to start the journey with a full understanding that none of the country is at zero level, of course, there may be already some existing processes, some frameworks, some structures for patient safety or quality of care or broader health system strengthening. But just to take a normative approach, that what should be the step-by-step approach if we wish to implement the Global Patient Safety Action Plan. But what I'm going to present is this approach, and later on we are planning to publish this as a guidance. Still, it is a consultative approach, and while I am delivering this presentation, this is also open for your suggestion. You can give right now or later on to us that how you would like to have this guideline. What are your feedbacks on? So it's a dual purpose. The approach, there is a mnemonic here, but I won't say it's only a mnemonic. This is what we hear everywhere. I won't say only healthcare. Wherever you go, safety first. So first to keep yourself safe in whatever section of your life or kind of a services you are availing, or even if you're providing services in hospitals or in any sector. And that's was very much a Hippocrates oath and the cardinal principle of medicine, to do no harm. So this is based on the safety first approach. And there is a step for each of these letters, safety first. So it's easy to memorize, and of course to also boost our morale that, we have to keep very much safety in priority. So this starts with S. That means we are starting with situational analysis. I will be kind of a bit elaborating them in subsequent slides. But just to present you situational analysis. then having awareness, advocacy, and stakeholder engagement, framing policies, strategies, and legal framework, establishing institutional arrangements and action plan for patient safety, developing technical guidance and safety standards, and then yielding change ideas and priority actions because we cannot do everything in one go. Facilitate implementation, and then institute a monitoring system to know that how our implementation is progressing, reporting the progress and success stories, sustaining and scaling up improvements, and then certainly tuning up and updating our plan and program. So this is a very generic step-by-step approach. You can see somewhere a hint of improvement cycle, a quality improvement cycle. So it's not that you start with S and finish at T, because it is going to be always a journey, a cyclic process. So once we have achieved our plan, then certainly we have to prioritize other actions. We have to tune up and again go from Y to T. So it's a cyclic process, at least for last 6 letters. So let me also explain you what we can do in each of these steps. Again, these are very normative generic guidance, and every country, even I would say every healthcare facility, can add on or can opt out of some of these activities. It's just to make a kind of a chronological step-by-step approach from where we start. So certainly, first, if we are starting a patient safety program, or even if we are revamping it, we need to know that what is the situation right now, both in the terms of what is the burden of harm, but also the policy landscape, who are the stakeholders, what are the priorities for us. So that all has to be done, and I think it should be done through a formal situation analysis. And if it can be documented, that can be the best outcome of this this step. Once we have understanding of what is the situation analysis, certainly we have to make community, stakeholders, policymakers, politicians everywhere aware. What's the importance of patient safety? We have to advocate, we have to make a business case that how much resources it can save. And with that, once the stakeholders are aware and they are motivated, of course, we have to start the engagement process. Then we certainly we have to frame certain policies, strategies, legal frameworks. That may be a quality or patient safety policy strategy. You might have seen a NQPS document. A lot of countries are working on that. But beyond that, safety goes into the health system strengthening, and not only talking about the safety of processes, but also the safety of medicines, vaccines, devices. So everything is interconnected. So that will also come from the situational analysis, that what are the areas where we already have laws or policies, and what are the areas where we still require more framing. Some of the areas, those are very specific to patient safety, like protection of health workers or even patients when they are reporting a safety incident. If there is no legal framework or even administrative guard for reporting it, certainly nobody is going to report those incidents. So to have a safety culture, an open culture, we need that a safe environment, a policy environment also to enable further actions that I will be discussing later on. So it's very important to understand what is the current framework and what are the areas where we still require further framing of strategies, policies, and legal actions. Then we move to institutional arrangements. Who is going to run patient safety program, whether it will be a standalone program or it is part of the quality of care overall agenda, or it is integrated with further with infection prevention and control, or even the health worker safety. So every country has their own landscape and priority and understanding how it should be run. But certainly we require certain institutional arrangement at the national level, at the subnational level, and even at the healthcare facility level that is going to implement all these activities. And to run all these programs, certainly we require some kind of a patient safety program and a national patient safety action plan. Again, these options are up to the countries whether they want to to have standalone programs or action plans, or they want to harmonize or have them as an umbrella initiative. Then certainly we will require technical guidance and certainly, of course, safety standards to reduce the variability and prevent harm. Guidelines in terms of the clinical guidelines, as well as the guidelines for education, for training, for reporting and learning system. So yeah, there's a list of technical resources that can be developed, and what earlier Dr. Rina presented at the global level, we have produced many global technical documents that can be used, and there will be many coming up later on. So we are very much here for supporting you in any of the area where you wish to have national guidelines, say on infection prevention and control, or on medication safety, or how to implement a reporting and learning system, or a health worker safety. So WHO has a lot of resources, and that can be useful for further adapting or creating technical guidance and safety standards. So these steps were more overarching to create an enabling environment in which a patient safety program can run. But we all understand that we cannot implement all the areas and everything at one go. So at some point of time, we have to prioritize what are the areas where we want to take the first step. And these can be based on the burden of disease, or the burden of harm from the sources from where it is coming, say infection prevention and control, or from medication errors or diagnostic errors. You can also look into the feasibility, the what are the areas, what are the low-hanging fruits, or maybe using Pareto principle, that what are the principles, few initiatives that can give you the maximum benefit in reducing the harm. So there can be different ways, but this require a brainstorming at the national level involving all the stakeholders, and it's very important to not only involving the national level functionaries to have feedback from the patients, from the health workers, those who are working at the point of care, because at the end of the day, they have to implement it. So their feedback is very important while implementing or even prioritizing the actions. And yeah, this is one step, but I would say this is the most difficult and most important step to implement at the finally. And yeah, no guidance can suffice how you are going to implement, because it's an operational subject. But certainly what we can define is what is the scope of implementation? Do we want to implementation national wide at one go, or take one or two provinces, or maybe a label of healthcare facilities, choosing primary care for diagnostic safety, or maybe surgical safety for tertiary care hospital. But again, yeah, all these illustrations. So the scope is important, where we are going to implement. We have to develop an implementation package. A lot of those things may be coming from technical guidance. That was one of the earlier steps. And we have to involve frontline staff and managers, and we have to address what is needed from them. So if they have a buy-in, they understand and they are motivated, certainly the implementation will be very smooth. But if it is just a top-down approach and we just introduce certain implementation package without having a good buy-in, certainly there will be challenges. So it's very important to have both bottom-up and top-down approach. Once we are implementing, certainly we requires monitoring of these activities that entails to having some key performance indicators, formats and templates, how these performance indicators will be reported. Also important it is to use our incident reporting system, if we have a patient safety reporting and learning system, to analyze this data. It's just not only about reporting. We learn from there that how our interventions are really reflecting in reducing the harm or the incidents. And if it is possible to create a real-time alert system for safety issues. Once we are implementing and we are measuring, certainly we can report the Global Patient Safety Action Plan. Also, that is one of the core indicator. A country should publish an annual report on patient safety or quality of care about overall the improvements and what are the challenges in the countries based on the data. Other activities could be disseminating the best practices or achievements through media or creating visual summaries like infographics, or even organizing periodic meetings or webinar to discuss the progress with the stakeholders. What we understand, because we have prioritized certain actions and it may not be national-wide, we might have taken a specific geographic area or a specific clinical domain. It's very important to sustain and scale up the implementation. And that requires very much a sustainable funding and resource support, but as well as a more strategic thinking that how we sustain it, how we get a better buy-in from the health workers, from all stakeholders. And yeah, every country may have their own ways of sustaining it. If you find it useful, recognition or a reward system can motivate stakeholders or health workers to sustain or improve. That could be one way of doing it. But there are certainly different ways of how we can sustain and scale up this implementation. And what we understand during all this process, we will find new areas where we can improve. There may be new challenges. There may be, we may find different ways by which we can more efficiently implement some of the activities or can improve faster. So certainly it's not a end of the implementation. We should review the process, our progress, the new ways of working, and then we should feed in again into the improvement cycle and try to improve patient safety. So these are the safety first steps. You may find them a bit generic. Some of the things we all know, but it's still there is always good to have a frame of mind, a framework, how we start the process, or how we can build on the different steps. So I stop my presentation here, but just operational discussion on a lot of presentation here we are able to make was because of the member state survey that we started in 2022 November. So this is a cyclic process, and this is also part of the obligation to the governing bodies of WHO. So every 2 years we have to report the progress on the Global Patient Safety Action Plan to the World Health Assembly, and the next due year is next year to WHA 78. And so we'll be very soon we'll be starting initiating the second round of the member state survey. You will be getting link. We are incorporating it also in a broader PHC survey agenda, but we'll be there for handholding if you have any issues in accessing the link. And I will be I will be requesting all the countries, not countries those responded last year, 2 years back, but all the countries in the AFRO region, those who were not able to respond the last cycle, please take it as a very important activity and respond to the survey. It helps both to have a global picture as well as to help you in improving the patient safety. What we have done with the survey data also to create the country situation analysis that our WHO regional office is sharing with you. So you have a better informed understanding of what is working and what is not working, what are the opportunities for improvement in your country. Thank you so much. I will stop here.
Dr. Nikhil, can we ask Jaka to run the slide of questions on implementation for 5 minutes?
Yeah, so I'm just displaying the question here. This is the QR code. It's the same QR code. So if you have understood what are these steps, can you indicate where is your country, or maybe from wherever region or your hospital you are coming, at what stage of this safety first you are right now?
Yes, that's it.
Can you display the question on Slido now?
Yeah, yes, they can use this. Then we can have at the same time the answers.
It's already there. Sorry.
Colleagues, do you see you can use the QR code to do the same exercise like we did for the first session? Yes, I'm seeing one participant typing.
Jacka, can you project the question 3, not the 2? So we are asking. Okay, now it's good. This. I would say it's not a hard and fast. It don't, it's just brainstorming, or I would say just feel free to pick one of the step. I can understand you may be at multiple step at one level, at one point of time. I can see awareness is quite performing well, and maybe some of the contribution may be from this workshop only, but yeah, that's an important step, I would say. So still I can see 10 participants online, so maybe we can wait for another 10, maybe 30 seconds. Colleagues, if you wish to still respond, please respond immediately. But I can see countries and yeah, the participants here are at different level. Still, I can see even 10% have said that they have some mature system they have implemented, and right now more on tuning and updating plans. So it's not all greenfield. Yeah, there are already existing framework, and then we will be hearing from the countries also after this how they are implementing. So yes, so it's heartening to know that there's quite a good awareness, and the kind of countries are working. There's monitoring and reporting system already there. Situational analysis, 10% of countries. So yeah, countries are at different level, but this is very much corresponds to what earlier Dr. Gertrude was also presenting. We are at initial stages in many of the countries. That way, I can still recall the graph one of the Dr. Gertrude was presenting about. So we are not anywhere far from any of the region or globally in the awareness and prioritizing patient safety. I think that work is quite well done. But certainly, I can see like facilitating implementation, it's 0%. So maybe we have started the journey. We are somewhere in the initial stages, and lot to come. I would say exciting things to come, and very hopeful. Yeah, by 2030, we'll be having everyone. Yeah, maybe at more mature stages. So I will stop here, and we can close this survey and over to the facilitator. Thank you. Over.
Pierre, you are muted.
Oh, I'm sorry. Thank you, Dr. Nikhil, for the presentation and for the comments on the slide of questions. I say we can take 5 minutes, 5 minutes to take a few questions for 5 minutes. There is already a question in the Q&A. Does the medication or diagnostic processes or which survey tool address issues related to the availability, functionality, and technological maturity of medical devices and equipment in terms of patient safety? Who wants to respond to this? Does the medication diagnostic process or which survey tool address issues related to the availability, functionality, and technological maturity of medical devices and equipment? It looks like it's a question specific to people dealing with technologies. Our panelists, do you have an idea of how we can address this? This is from Andualem Wube Jejeresko. Who wants to give an idea of what could be? Nikhil, go ahead.
Well, let me attempt, yeah, but yeah, other panelists can join to respond this question. What I understand, the question is about when we are talking about medication or diagnostic safety, whether we are covering about functionality of equipments and availability. Certainly, if you this year campaign on diagnostic safety, when we are talking about, it's not only about diagnostic safety as a decision making or a clinical decision making process, but also looking into the laboratory equipments and their access and their safety. Same is with the medication safety. We earlier also produced a document on lookalike and sound-alike drugs that talks about their labeling, packaging. So yeah, the focus is more on processes, but access to the devices and product is very much integral part of any patient safety initiative. Even in the member state survey, we asked specific questions about safety of medical devices, about safety of vaccines, about safety of medical products. So that is very much integral part of when we look safety in healthcare as a holistic approach. Thank you. Over.
Yes.
Tegenu Guta, can you put the question in the... Tegenu Guta, you can put the question in the chat, in the Q&A. I'm not seeing any other questions, so.
I can see a question from Dr. Fahmy in the question. If I think it will be more relevant if you or Dr. Gertrude respond to this. This is specific context of.
From Fahmy?
Yeah.
Yes, okay. So thank you very much about how do we integrate patient safety with other programs. There's no one way of doing this, but once we sit together in dialogue, there are samples from other countries that I can share. They have an overarching, probably directorate for quality management. And under quality management, they have specific units or interventions for the related programs like patient safety, IPC, customer care. So it varies from country to country, but our recommendation is that these related programs are all intertwined it's difficult to implement any of them as a vertical program. So it's best we bring them together so that there is good coordination and interlinkages on their implementation from the top, from the national level to the facility level. And I keep saying that at times it's only at the national level that we tend to see a lot of verticalization. But once you move sub-national, you find that you don't even have the logistics and the human resource to have vertical programs for these related ones. So it's best to bring them together in terms of planning, implementation, monitoring, and evaluation. There are examples that we can share with you from other countries. I think Kenya is one country. Others have also started the process of bringing them together. I think I can mention Namibia also as an example that is making the efforts to bring these related programs together. Thank you, Enova.
There is also Burkina Faso and the other country and Senegal in West Africa. Yeah, that's it. I think we can you hear me?
Yes, we can hear you.
I think we can close this session and move to the next session. We are running 2 minutes late, which is not so bad. So I would like to thank the two presenters, Dr. Avotri and Dr. Gupta, for the good presentations and the interaction with the participants. If you allow me, we can move to country presentation. I think we can start with Ethiopia, then Liberia, and then South Africa on alphabetical order. So is the presenter for Ethiopia ready? Jacker, can you put on the presentation for Ethiopia? Our IT support.
Just a second.
No problem. No problem. That's it. I think for Ethiopia is Dr. Deneke was going to present.
So, Dr. Pierre, I have patient safety landscape and overview of global patient safety report. That's the presentation I have at my end. Is it one of these?
No.
But
Let me
Ethiopia can share their own slides if they have rights.
Yes. Do they have rights, Mr. Jaka?
Who?
The presenters.
Please give me the name of the presenter.
Let me give you the name.
I can promote him as a panelist. Or he can raise his hand.
Is Dr. Deneke, I think.
Deneke. We don't have any Deneke among the participants.
Let me check.
Ah, sorry. There is someone saying that he's using another. Yeah,
Is Deneke Ayele. Dr. Deneke Ayele.
Yeah, he's using the computer of Dr. Fahmi, I think.
Yes, he's with Fahmi, yeah.
Okay. Let me but there is two Fahmi. Oh. Okay, I'm going to promote them both. So, Dr. Fahmi, you have been promoted as panelist.
Okay,
You
now,
can share your screen. Dr. Fahmi, can you hear us?
yes.
Yes, we are hearing
There is
you.
another computer in the same room. Please ask the second computer to disconnect or to mute himself and stop his speaker. Mute his speaker and his microphone, both of them.
Now we are ready.
No. Or he has to move to another room
Okay.
Only one computer.
or disconnect.
Actually, we are using only one computer.
That's impossible. If we have an echo, it means you are using two. Or maybe a phone, or maybe you are using a phone. Can you start sharing your screen, Dr. Fahmi?
Click here to show
Hmm?
Click here.
Zero.
Or Dr. Pierre, can you send me the presentation by mail?
Yes.
Or you can share it from your side. Oh, here we have the presentation.
Can you hear us now?
Yes, we
Yes.
can hear you.
Clear and loud. Go ahead, please.
Can you hear?
Yes.
Okay.
I have shared
Yes,
the
sir.
presentation and I will run for you. Please say next whenever you want to go to the
Can
next.
I continue?
Yeah, sure.
Okay, thank you very much. This is our pleasure to share our experience for on patient safety, and I will continue for the next 15 minutes. Next slide, please. This is outline based on the previous shared templates. Next. This is the overall history of patient safety and quality concept in Ethiopia as a milestone, starting from 1993 in Gregorian calendar. Next. So, based on the template regarding to policy strategy in our country, safety has been the agenda of the health sector transformation plans in Ethiopia. So we are currently implementing the second transformation plan, in which the current HSTP has 5 strategic objectives. Among those objectives, patient-centered care and avoiding preventable harm from healthcare delivery is related to safety included in the strategy. So the strategy contains the below listed around 5 intervention areas to strengthen the patient safety and quality strategy, incident report system, establishing and supporting the advisory council, which is already established, and we are implementing also the clinical audit practice, and we are participating on World Patient Safety celebration, and we are conducting also National Patient Safety Days commemoration. Next. So currently we do have also a strategy called Health Sector Development and Investment Plan, which have around 9 objectives. Among the 9 objectives, harnessing innovation, quality, safety, and equity in the health system is one of the objectives. Under this objective, there are interventions specific to safety. The first one is strengthen the implementation of national healthcare quality and safety strategy. As I said before, there is also strengthening nationalization of patient safety. We are creating also learning platforms to share best practices among health facilities in Ethiopia. We are also implementing and scale up health innovative practices. So to the better implementation of our strategy, we already developed a safety project called Safe Care Align project. For the detailed implementation of this project, we already developed and we developed a patient safety guidelines, and we already launched it with regional health bureaus and our collaborative partners during this year Patient Safety Day commemoration. Next. So for the better implementation of, for the better outcome of patient safety in the health system, we do have around 3 major objectives. The first one is establishing system to reduce patient harm by promoting best practice among health facilities in the national and regional level. The second one is creating a culture of safety within the health facility at all levels, nationally and regionally. The third one is empower and encouraging a culture of patient incident reporting by healthcare providers with the knowledge and the tools necessary to deliver safe and effective care of the patients. These are the major 3 objectives in our strategies and guideline. So why patient safety is an agenda? This is clear. Just to tackle the health care challenges. When you see the challenges, majorly in Ethiopia, AMR, antimicrobial resistance, IPC, safe surgery initiative, related challenges, healthcare acquired infections are the major challenge in Ethiopia. And we have done a national level patient safety study. These are the results. Next. So for the best outcome of patient safety, we are doing our program with implementing partners, including WHO, and the WHO working collaboratively on patient safety, on its advocacy and scale-up, both including the public and private health facilities to provide safe health care. WHO also supporting the ministry to strengthen safety and quality strategy, including IPC, AMR, surgical and blood safety program areas, both technically and financially. There are also other partners implementing on patient safety and IPC also, like USRQHA, quality health activities. That means ICAP Ethiopia, ICHA, and Pronot Harvard. They are supporting the ministry with different patient societies. Next. So when you see the specific patient safety related activities in the country, both at national and regional level, from the very beginning, we started IPC program in the early 2005, followed by IPC and patient safety guideline implementation guideline development during the year 2011. Then after, we established a clean and safe hospital initiative, followed by saving lives through safe surgery. That means surgical safety initiative using the surgical safety checklist. We started also Patient Safety Day commemoration since 2019. Patient safety also integrated in healthcare quality strategy in our country during this year. Currently, there is structure at national level to coordinate the healthcare safety program, which we call health system innovation quality lead executive office under the Ministry of Health. And we have also national patient safety team and technical working group advising the ministry and our office. We also already established a patient safety advisory council composed from different partners and patient societies supporting the ministry. Next. We have also nationally, we develop, as I said before, we developed also implementation guideline and training package prepared with in collaboration with WHO and other partners. We provided for healthcare professionals extensive capacity building and mentorship program. Patient safety study, as I said before, we already finalized, and it is under finalization to disseminate for our stakeholders and health facilities. We introduce a new initiative called Patient Safety Friendly Law Staff Framework to be piloted at selected health facilities in our country. We are implementing that. We already orient hospitals and set their baseline, and we externally validate their performance last 2 weeks, and we are finalizing the report. We are providing technical and financial support for our regions and health facilities directly. And we are conducting a review performance at national level with our partners. Next. So at the sub-national level, there are different activities we are implementing with the regional health bureau, including health facilities. So the below listed activities are the sub-national level activities. There are also equivalent structures established at regional health bureau and health facilities integrated within the quality units. They are also practicing clinical audit, including safe surgery, blood safety, prevention of hospital-acquired infections. We are also implementing infection prevention and control practice with regional health bureau at health facilities, including mentorship and coaching. They also providing capacity building for their facilities in collaboration with respective regional implementing partners. They are also conducting at cluster and regional levels their own performance integrated with other programs. We also expected them to report and follow up to establish a follow-up system using DHIS2. We are following them through their regular reports through DHIS2. Next. If we see the few KPIs related to safety, including surgical site infection rate monitoring, these results are including the last year, the previous 3 years performance. When you see the surgical site infection rate, it is decreasing time to time in line with the target in our strategy. It is in good performance. Next. This is IPC standard performances by region. When we see the last one, that is the national average, IPC standard performance of health facilities reported by regions increasing time to time. It is in good progress. Next. As I said before, we are also initiating the implementation of patient safety friendly hospital framework as a member state of since Ethiopia is elected last year among the 6 countries. And as I said before, we have done orientation for selected hospitals and they did their own self-assessment, and we have done the external validation for the last 2 weeks, and we are compiling the report. Next. When we see the lesson learned, what we learn is there is a strong collaboration to the scale up of program requires resource mobilization. Innovative intervention is necessary to the high impact addressing the cost effectiveness of the patient safety challenges. Intervention also needed to the scale up towards primary health care unit and private hospitals, including clinic and special centers. There also should be a strong collaboration with partners and health facilities at all levels. Next. So we do have some best experiences. Nationally we are doing to integrate the quality and safety program in pre-service training program in universities, which is on finalization stage. We developed already around 8 modules. Among those modules, safety and quality are part of the pre-service training materials in universities to be provided for students. We started also healthcare quality training, MSCC program. That means the second degree program level in which safety is included. MOH leadership, Minister of Health, our Minister of Health leadership commitment is also helping us in advocacy and partnership with other partners. We are also doing with regions and implementing partners annual plan alignment with public and private facilities and implementing partners in our country. And we are integrating IPC in e-learning platform to strengthen the capacity building program, since IPC is the main pillar of safety, to get a cost-effective initiatives. Next, when you see our challenge, as we discussed before, challenges are the same in our setting also. There is low incident reporting and learning systems through digitization of health facility. So we need to digitize health facilities in the future. We need to also strong capacity building for health facilities, including experience sharing from the same context countries, a strong partnership for funding. We need that, and there should be strong collaboration with countries having best practice on patient safety friendly hospital framework implementation. We do have as a challenge staff attrition. So to alleviate this staff attrition, we are doing regular capacity building and mentorship with WHO and other implementing partners. We do have also a shortage of IPC supplies and low level of awareness at lower health care level facilities. For this, we are planning to do a strong clinical audit practice and to do ongoing mentorship and coaching. Next. So this slide is showing some of the patient safety working documents. The first one is, as I said before, the National Patient Safety Guideline. We already launched it. We are also finalizing the incident reporting and learning system operation guide. The last one is positive patient identification system implementation guide. We are planning to pilot in few selected hospitals, including primary health care units. Next. This was during Global Patient Safety Hospital Framework Initiative orientation for selected hospitals in collaboration with WHO, country office in Ethiopia, AFRO, and Pakistan safety team. Next. So finally, we wanted to acknowledge regional health bureau health facilities, both public and private health facility experts supporting patient safety friendly hospital framework implementation, the advisory council members and the technical working team. We also thank to WHO country office, Dr. Bijoy, Dr. Fami and their team, WHO headquarter, AFRO and AFRO team, and all supporting the patient safety program in Ethiopia. Thank you very much, and this is all about our experience in short, and hopefully the detailed report of our country experience will be shared for the larger group as we discussed with Kario. This is all in short our experience, and Doctor, if you have time, a few minutes, Dr. Fami can add some points. Thank you very much.
Dr. Fami, 1 minute.
One
Dr.
minute.
Fami, 1 minute.
Okay, thank you. You know, Danaka has already presented fully, very comprehensively. So, as patient safety is evolving in this country, really, I want to really emphasize the importance, the critical input of, the leadership in Ethiopia. The leadership is commitment is very high at ministry level, and we do have also promoting for the leadership commitment at regional level, facility level. We are going to start the collaborative initiative in initially in 10 hospitals. Now, ministry is committed to really scale it up, maybe add another 10 hospitals to start it in 20 hospitals. So we finalize the baseline assessment. We are validating. The validation will be finished next week. So we're going to launch it maybe after 2 weeks with involving all regional health bureaus and the facility leadership. We are going to launch it. So we're promoting even the facility level leadership should invest something on the project. This is how we are going on. So hopefully from that project, which is going for the next 15 months, we are going to learn a lot and help us to really scale up the patient safety program initiative to even at a higher level of hospitals, as well as we are in parallel developing capacity building, other guidance for primary healthcare unit, learning from this initiative. Thank you.
Okay, thank you, Fami. There is a question for Ethiopia. Read it and respond as soon as possible. So we are now giving the floor to Liberia. I hope Louis can hear me. I've sent a message through the chat saying we need to the people, the presenter for Liberia, to raise the hand so we can upgrade him as a panelist to present. I'm seeing Comfort King. Are you presenting? Are you presenting for Liberia? Can you write in the chat that it's you who is presenting? I know for
Promote King if he can accept he declined. Comfort King declined the promotion of. Please accept the promotion so you can do your presentation.
Buyane should also accept or raise the hand to accept to be the presenter for South Africa.
We have Comfort King as panelist. Comfort King, could you please activate your microphone and camera?
Yes, please.
Yes. Can you share the presentation? We can see you. Yes. Mrs. King, Comfort. Go ahead.
Yes, I'm here.
Can you share, or you want our IT to run the presentation?
Your IT can share. Thank you.
I don't have the presentation, Dr.
You have.
Pierre.
I received it by email. I sent you by email.
When? I don't.
Yes, you should have it. I checked your emails. I sent. Yes. You don't see it?
Yeah. Now I received it.
So I'm sharing the presentation and I will run.
And this is for South Africa.
Liberia or South Africa?
This is South Africa.
I have Liberia, Ethiopia.
Yes, Ethiopia has passed. Now put for Liberia. Liberia. Please. Yes.
Okay.
Yes, go ahead.
Thank you. The progress on patient safety implementation in Liberia. Next slide, please. This is our outline, the country context, the status of patient safety activity, the challenges, lesson learned, and the way forward. Next slide, please. So a brief patient safety country context, our journey. In 2003, the end of a 10-year civil war. In 2010, we established establishment of the Liberia Medical Dental Council. In 2011, the National Health Policy and Plan was established. And in 2012 to 2013, the EPHS based assessment accreditation was done. And 2016, the Healthcare Quality Management Unit was established. And in 2017, the National Health Quality Strategy 2017 to 2021 was established. And 2018, the IPC guidelines and the antimicrobial resistance was launched. In 2021, the launch of the first patient safety right chapter and the AFRO program. In 2022, to date, the new National Health Plan for 2022 to 2031 and the EPHS2 was revised. Next slide, please, and validated. A brief patient safety context continuum, the health system indicators, routine quality assurance process in at least a service delivery area in the health facility was 77% health facility. And the second is documentation of the quality assurance in health facility, only 1% of the health facility. Mechanism to collect and review patient opinion on health services, 15%. Health facilities offering inpatient services with case review system, 36% perform review prenatal deaths, 22% performed maternal deaths review. Next slide, please. The National Health Quality Strategy 2024 to 2028 goals to ensure improved healthcare quality and safety for better health outcomes for the population in Liberia. 4 strategic objectives. Objective 1, to strengthen health system governance, organization, and management to deliver quality essential services, system environment improvement. Strategic objective 2, to improve clinical effectiveness. Strategic objective 3, to ensure patient and provider safety. And objective 4, to deliver people-centered care, engaged and empower patients, families, and communities. Next slide, please. Adaptation of the Global Patient Safety Action Plan. So in 2020, we launched the patient rep chapter, and this year we will be aligning it with the WHO Global Patient Right chapter to suit our Liberia context. Next slide, please. Drivers of patient safety agenda. Patient safety is a critical area for improvement in the investment plan for building a resilient health system in Liberia and the National Health Quality Strategy. Patient safety embedded within the WHO's 6 health building blocks. By addressing patient safety, health systems are being strengthened to achieve the universal health coverage. Country situational analysis on patient safety using the APPS tool conducted in 2017. Compliance to patient safety areas, 47%. Maternal, newborn, and child health, national crisis. High maternal mortality. 3 women died per day while giving birth. High newborn mortality. 23 newborn deaths per day. High stillbirths. 40 stillbirths per day. Next slide, please. Partners supporting patient safety. WHO support to Liberia patient safety journey, normative, global, and regional guidance, direction on patient safety gaps, curriculum. Technically, national policy, the National Health Policy, the National Health Quality Strategy, guidelines, SOP, and protocols. service delivery, procurement of medical equipment, patient safety alliance plan, and supplies. Capacity building, training of healthcare worker in quality, basic BEC and patient safety, basic emergency care. Financing, funds, quality improvement, and patient safety activities. So these are partners supporting patient safety: Last Mile Health, Chipaco GRZ, USAID, UNICEF, the Susan Thompson Buffett Foundation, Clinton Health Access Initiative, UNFPA, Quakai. Next slide, please. Status of patient safety activity, policy and tools. At the national level, we have the National Health Policy and Plan 2022-2023 validated and disseminated. And we also have the harmonized, we also have the HSSP 2022-2025 and the EPHS, the Essential Package for Health Services, validated. So the HSSC is actually the Health Sector Strengthening Plan, and the National Health Quality Strategy 2024 to 2028, validated. The NAPS, the National Action Plan for Patient Safety 2025 to 2030, updated. The Patient Rep Chapter, updated. The National Guidelines for the Health Service Planning validation. The National Strategic Role and Essential Medicine list, validated. The National Guideline for the CPD, validated. And the National Guidelines for the Occupational Health and Safety, validated. Draft SOP for adverse event reporting, the National IPC Guidelines 2018, and Strategic Plan 2023. The National Action Plan on AMR 2018 to 2022, and Antimicrobial Stewardship 2021. Next slide, please. Implementation of the tool. The national SDG rolled out Massarado County, in Grand Cape May County as well. Capacity building for healthcare workers in quality, patient safety, and resilience. Integrated supported supervision for IPC WASH and RMNCH in health facility. Quality of care teleconference was conducted. Activation of the quality management team. Ongoing integration of antimicrobial stewardship programs into the quality management team in selected hospitals in Liberia. Maternal and newborn death review. Pre-positioning, medical equipment, IPC, and WASH supplies. Next slide, please. Integration with IPC. For patient safety, those that we work with, those documents that we have are National Health Quality Strategy, the IPC guidelines, the WASH, the response of the PHES, and the RMNCH. Next slide, please. So, participation in a survey. Participated and completed the Global Patient Safety Survey in 2022. Liberia participated in the survey. Findings prompted the development of the NAPS for patient safety, motivated revision of the patient chapter, drafting of SOP for the adverse event reporting. Next slide, please. Lesson learned and challenges. Lessons. Strong political buy-in, stakeholders' engagement and collaboration. Improving quality and patient safety requires continual learning and capacity building. Strong leadership required at MOH to serve the sustained quality improvement and patient safety. Continuous mentorship is critical to improve quality and patient safety. Challenges. Limited funding to support patient safety. Name, blame, and shame culture dominant. Health service delivery is suboptimal. Limited knowledge and skill in patient safety at national and subnational level. Limited data information on patient safety and quality of care. Next slide, please. Way forward. Continue advocacy for patient safety. Validate and implement the NAPS for patient safety 2025 to 2030. Awareness on patient safety and patient rights. Implement the National Health Quality Strategy 2024 to 2028. Capacity building for health worker in quality and patient safety. Integrate patient safety into pre-service training curricula and CPD for health workers. Include selected measurable quality of care and patient safety data indicators in the HMIS. Conduct a rapid survey to generate data on status of patient safety and quality of care. Next slide, please. Thank you for listening. These are pictures the day we launched the WHO 5 Moments of Medication Safety mobile app, and WHO donates lecture to healthcare quality management for adverse event reporting in selected hospitals. Next slide. Thank you.
Thank you, librarian. Thank you. Keep an eye on questions arising for you so that when we have Q&A, you get ready to respond. So now we are giving the floor to Ronald Steinobel from South Africa to give the last presentation. I hope you can keep it short. We are running out of time. Go ahead. Mr. Jacker, have you upgraded the person?
Yes, yes.
Fantastic. Thank you.
Dr. Ronald, could you please activate your microphone and camera?
There you are. Good afternoon, everyone. Can you hear me?
Yes, we can. Can you activate your camera, please?
I am trying to, but for some reason, it doesn't want to go. Let me just see here. Okay. It looks like something on my setting is not working, so apology for that.
Okay, no problem.
Uh,
Do you want to share your slide or do you want me to do for you?
Sorry, no, video is not working. Please share. It's okay. Did you already share? Okay. Okay, no,
Okay,
it's
okay,
fine.
you can
Don't
share.
worry.
You can
Okay.
share.
Okay. Are you able to see my screen?
Yes, open the, yes, go on
Yeah.
slide mode.
No,
Perfect.
you can see it. Okay. Thank you, everyone. And thank you for the opportunity to present the activities that South Africa is currently busy with on patient safety. So the content of the presentation will just be a brief background of the country, the National Patient Safety Strategy, what we are doing about that, the national drivers, WHO support, the partners that's supporting us, the overview of our patient safety activities, challenges, lessons learned, and our feedback regarding the Global Patient Safety Survey. So South Africa is located at the southern tip of Africa. The Ministry of Health sets policies and monitor implementation. And then we have the 9 provinces within the country that are autonomous and responsible for providing healthcare services. We have a population of 56 million, of which 80% of the population is making use of public health services. We've got 3,475 primary healthcare facilities and 385 hospitals. Currently, South Africa do not have a standalone patient safety strategy, but our Health Act is very strong in regarding to what is required to ensure that as a country we are able to improve patient safety. So in the National Health Act of our country of 2003, Chapter 6 indicates that prescribes that the country have to institute standards for health facilities, which will be monitored by the Office of Health Standards Compliance. Then Chapter 10 of the Health Act specifically states that the Office of Health Standards Compliance, who is the regulatory body who is assessing health facilities, must be established. And those standards, which is required by the National Health Act, of course, includes standards for patient safety. So in this regard, to make into effect the National Health Act, the norms and standards regulations applicable to different categories of health establishments was promulgated in February 2018. Next. Okay, so the national drivers for the patient safety agenda in South Africa, and I just want to emphasize that what I am going to present today is the activities that the national, the Directorate Quality Assurance and Improvement is responsible for at the Ministry of Health. So there are many other programs in the Ministry of Health, like medicine, equipment, maternal health, HIV, TB, that all have an element of patient safety within their programs. So if we just look at what the Quality Assurance and Improvement Directorate is responsible for that relates to the patient safety agenda in South Africa, we divide it into 3 dimensions. So the first one is quality improvement, second one is customer feedback, and the third one is patient safety. Quality improvement, under the quality improvement dimension, we specifically look at quality assurance assessment tools for health facilities. So under that will fall the standards which I referred to, which is required by the National Health Act. And then based on those assessments, the facilities are required to do quality improvement on the gaps that are identified. Under customer feedback, we have patient experience of care surveys, as well as complaint, compliment, and suggestions. So that is feedback that we get from our patients to inform patient safety risk and gaps that are identified by them. Then the third dimension, which is patient safety, relates to patient safety incident reporting, infection prevention and control, and clinical audits. So if we look at the role of WHO in supporting South Africa specifically with some of these dimensions that I've just referred to, we've really received a lot of support from WHO. They provided technical assistance when we developed the national guideline to manage patient safety incident reporting and learning, as well as the national guideline for infection prevention and control, and the strategic framework and manual for IPC. They funded the printing of the national IPC strategic framework and manual. They also funded training of provincial employees on IPC. And they also provided technical support and training through workshops to provinces during the COVID pandemic. And they are currently assisting us with technical support in the development of the national quality policy and strategy. Partners that are working in South Africa specific on these areas that I've just mentioned is the Better Health Program for South Africa, which is a program that is funded by the UK government. They provided technical support for us to analyze our patient safety information data over a 2-year period. And they also provided technical support when we revised the national guideline for patient safety incident reporting. And they also provided technical support for the rollout of the National Quality Improvement Program. We also have the Health Systems Trust that funded the development of the Patient Safety Incident web-based information system, where facilities report patient safety incidents. And then we also have the European Union, USAID, and CDC, who supports the Ideal Clinic program with the implementation of norms and standards regulations to improve the quality of care in primary healthcare facilities. So just really a very brief overview of those dimensions that I've mentioned that the Directorate of Quality Assurance is responsible for. So at the national level, we are responsible for developing national guidelines and then also for monitoring the implementation of those guidelines. So once a national guideline is rolled out, we have national workshop with all those 9 provinces and the facilities within those provinces to roll out those guidelines. And then we have several systems in place to monitor the implementation of those guidelines, because these guidelines are applicable at all levels of care, whether it's a primary healthcare facility or a hospital. So if we look at the first dimension, quality assurance and improvement, the Ideal Clinic and Health programs was developed respectively in 2015 and 2018. So these programs developed quality assessment tools, which is aligned to the regulated norms and standards as required by the National Act. So it's a self-assessment tool that facilities use to assess the quality of services provided at health facility level. Then also in 2020, the National Health Quality Improvement Program was rolled out to all provinces. And with that program, the Quality Learning Centers was also established in 2021. And the learning centers basically assist facilities to do quality improvement plans based on the quality assessments that were conducted in their facilities. With customer feedback, in 2018, the National Guideline on Conducting Patient Experience of Care was published. And then in 2018, the National Guideline to Manage Complaints, Compliments and Suggestions was also published, and it was revised in 2020. And then the patient, under the dimension for patient safety incidents, the National Guideline for Patient Safety Incident Reporting and Learning was published in 2018 and revised in 2022. And then lastly, the National Infection Prevention and Strategic Framework and Manual was published in 2020. So just to give you an idea how we monitor most of these guidelines is that on the Ideal Clinic and hospital programs, we have a web-based information system where facilities capture the assessments, and at national level, we are able to access the results. And the same applies for patient experience of care surveys, as well as the complaints and the patient safety incident reporting and learning. So these are all web-based information systems that facilities use to enable national level to monitor the implementation of these guidelines. So the challenges is that, and I've heard it mentioned during the course of this afternoon, that programs work in silos. So often we don't know which program is doing something and we end up doing the same thing. We have budget constraints, so there's no funding for IPC posts at national level and at facility level. There's system issues resulting in efficiency of equipment and maintenance of our facilities. There's a need to capacitate staff members in terms of IPC at provincial and facility level. Even though we've done a lot of work, there's still a lot of work to be done on that. Due to not considering IPC as an occupational specific dispensation occupation, there's a high turnover of staff for those posts, leaving a void in the system. There's a need for improving of data quality. So I've mentioned that we've got very well established web-based information systems, but there is a need to improve the data which is captured by health facilities. We also need to move away from compliance, because we have these assessment tools, which all facilities are now conducting, but we need to focus on improving on the results of those assessments. We also struggle with staff to report patient safety incidents. So we have a low culture of reporting patient safety incidents, especially in primary healthcare facilities. Then the lessons learned with all of these programs and national guidelines that we have rolled out and are monitoring. There was an improved coordination and collaboration between all programs, including public and private health facilities. We had improved referral pathways between different levels of facilities. We were able to share best practices. Staff now better understands the norms and standards, regulations, and therefore are the compliance with those regulations have improved quite a lot. And we also need to ensure that the compliance with the regulations translate in positive health outcomes. Regarding the Global Patient Safety Survey, South Africa did submit in 2022. The task was coordinated by the Quality Assurance and Improvement Directorate, but it was really a mammoth task because patient safety is cross-cutting across all programs. So if you're familiar with the survey, you will know that you have to include all programs when you do the survey to get all the information that is required. And it was sometimes challenged to get inputs from all the programs. But on the positive side, we definitely did raise awareness with all the programs regarding their role in patient safety. Our challenge in this regard is that even though we've done the survey, we need a dedicated staff member to identify to address the gaps that was identified with that survey. Thank you for listening, and that's the end of my presentation. Thank you.
Thank you very much. Thank you. So we do have 2 questions. We open Q&A for 5 minutes. We do have already 2 questions. Questions from for Liberia. The question is, what is your strategy for engaging and empowering patients
family and community on patient safety. Mrs. Regina Kamoga asked the same question to Ethiopia. So, Liberia, do you want to answer that question? The presenter for Liberia, Comfort King. Can you open your microphone and answer? It looks like she's not hearing me. So, Ethiopia is family.
Yes.
Dedeke?
Yes. Actually, we tried to respond on chat box and empowering patient, family, and community is very critical and very important. We agree that, and we already included this strategy in our strategy and guideline, as I presented earlier. What we are doing national is we are currently adopting the WHO Patient Safety Rights Charter to develop a national level guidance to be used at regional and health facility level. We are also establishing a patient advisory group and we are capacitating them to learn each other using different platforms and consortiums. So we are expecting to do the same at regional and health facility level. We need to have strongly work collaboratively with our partners, including WHO. And Dr. Fahmi may add some points on it. And
regarding the patient groups, we are organizing different associations, like Diabetic Association, Cancer Association, Parkinson's Association, available patient group like HIV positive associations. So we develop at national level, we develop a consortium of these different associations together to establish one consortium. The same thing will be replicated at regional level. And then at facility level also, we are promoting to establish such facility level associations, especially under this collaborative patient-friendly hospital initiative. We put as a plan the facilities to plan such initiative, organizing patient groups. So we are developing simultaneously a capacity building package, communication capacity package and a negotiation package for patient groups, providing support, engaging them on planning and monitoring of patient safety related activities at facility level, even at regional level, as soon as they are getting strong enough and be able to be capacitated. So this is an initiative there. There is also one platform that is already on practice. The community groups, at facility level, there is a quarterly meeting, community representative meeting with the facility heads. So we are also encouraging to use that platform, patients to express themselves, especially making agenda quality and safety of the service, making a priority agenda on that platform, on that meeting, community meeting with the leadership of the facilities at hospital and health center level. Over.
Thank you. Liberia, Mrs. Comfort King, can you come in and share how you manage the issue of patient empowering? Can you hear me? Can you open the microphone and answer? And while we are waiting, let us give the floor to South Africa. Is being asked the same question. South Africa?
Yes. So in South Africa, I've presented some of the information what we are doing to engage with patients. So we have the patient experience of care survey, where we get input from patients on what the experience is of using our health services. We also have the compliance guideline, and when that was published a few years later, we also published a mobile complaints app to allow the public to download the app, and they can then log their complaints for a specific facility on the app, and at national level we are able to monitor that. We also have, as part of the norms and standards regulations, a requirement is that all hospitals and primary healthcare facilities must have, hospitals must have a hospital board, and primary healthcare facilities must have a community health service board. And on these boards consist of, amongst other people, members from the community, which of course include patients. So by doing that, facilities ensure that they hear the voice from the patient as well through those structures that are at facility level. And then we've got quite a few of patient groups, specifically for TB, HIV, that's also advocating for patients' rights. Thank you.
Thank you, Rona.
Hello?
Yes, Comfort, go ahead. 1 minute, please. Go ahead.
Okay.
Yeah.
All right. So for Liberia, we have the National Patient Safety Action Plan that we are about to validate and launch, which is going to guide us in our implementation process. And our plan is to decentralize patient safety activity in the country. So after the validation of the National Patient Safety Action Plan, all that is needed to be done will follow. Hopefully, from now to December, we should be done with the validation. Over.
Thank you. Thank you. I think we have responded all the questions. Dear panelists, do you think there is a question that is left out? Mr. Jacker, as we are heading to conclude with the next steps, are you willing to put on the last slide of question for the participants so that I can have some remarks on the next steps? How can WHO support you in improving patient safety? Please suggest some support areas. Can you hear me?
Yes, we can.
Yes, thank you. Say, kindly use the QR code for the active poll. Thank you. While you are responding, there is a question about the recording, the presentations. All the session has been recorded. A link to access it remotely will be shared. All the presentations will be shared. All the registered people should be able to receive all the materials. That's it. So let us take maybe 3 to 4 minutes wait until more people can make their suggestion. Dear colleagues, dear panelists, thank you very much for your participation, active participation. First of all, the first next step is to assure you that our team and the team, our team meaning the team in the regional office for the African region, with the team in the headquarters, we are all committed to support countries. So our support can be accessed through sending to us requests. You can also send requests through the country offices in your respective countries. We take note of the identified area of support you need, and we will look into and plan on how we can provide this support. Without taking more time to you, because some of them are, it's 6 p.m. in Southern and Eastern Africa. So a big thank to you all, and looking forward to sending you all the materials and waiting for your feedback. Thank you very much. And we are closing in about 1 minute. Thank you so much, and bye-bye. Thank you.
Thank you
Bye-bye.
very much.
Thank you. Bye-bye.
Thank you.
Have a good time.
Thank you. Bye.